Hello, this is Dr. Stanley Lang. Welcome to this broadcast, which the topic is stress and heart disease and the insulin connection. So I'd like to tell you a story about a couple of patients that illustrate some of the issues associated with this. One patient I saw this week was an older gentleman who had been successfully dealing with his heart disease now for probably about 20 years. He had a heart attack after 9 years of doing everything perfectly. His cholesterol levels were perfect according to the cardiologist. He was on the right medication according to the cardiologist. Everything was perfect. And after he had his heart attack, he confessed to me that he was depressed for quite a long time because he'd spent a lot of effort paying attention to every slight detail related to what most people focus on when it comes to heart disease. So his blood pressure was good, his cholesterol was perfect, and he was on all the right medicines. So from a cardiologist's perspective, he was doing just fine. We talked some more, though, and I suggested to him that the probability was high that he'd been under a lot of stress when he had his heart attack. And then he admitted to me that he had been, in fact, had been under incredible amounts of stress. And I explained to him how stress changes the body's system. And the stress response from the brain can actually start to create insulin resistance. So the insulin connection with this heart disease issue and stress, the insulin connection is that we do create insulin resistance by lots of different things that we eat incorrectly or eat too much of, but just chronic stress alone can cause insulin resistance. And how this happens is a pretty complicated pathway I won't mention, but stress does a lot of other things. It makes a lot of other inflammatory molecules go up, so it makes the arteries stickier. It makes a lot of other molecules like cholesterol particles more inflamed. And so I explained to him how stress was probably the major player and not the minor player in his having a heart attack. And so doing everything perfectly, if you're not dealing with stress, you still dramatically increase your risk of heart disease, especially if you're a male, but increasingly in females. Now, you can dramatically increase your risk for heart disease just by being in insulin resistance, even if you're not having any stress. And insulin resistance is where the body becomes more and more resistant to its own insulin signal, so the insulin levels increase. Insulin resistance is the single most highly correlated metabolic disorder with the calcification of arteries. So when arteries harden, that means calcium is being deposited. And so we can measure this calcium in arteries. It's called a calcium score. And the calcium score correlates more highly with the probability of a heart attack than any other thing that we can measure. You can measure all sorts of chemicals in the body, cholesterol, homocysteine, C-reactive protein, other things. But the thing that correlates the most with the probability of heart attack is the calcium score. And the thing that correlates the most with the calcium score is not cholesterol, it's insulin levels. So insulin resistance is the big player when it comes to the person's risk for heart disease. Now fast forward to another patient that I saw a couple of days later who is very healthy, in his 40s, is just a bit overweight. He thinks he's actually 20 pounds overweight. He's physically active, and from all angles, one could look at this person and say, this person has a really low risk of having heart problems. He's had a cholesterol level done some time ago, and it looked fine. So most people would look at him and say, very low risk. I look at him and say, no, not very low risk, because of his extra weight, I know that he's in insulin resistance. So I want to encourage you to pay attention to this detail and to make every effort you can to modify your diet so that you're not in insulin resistance. I wish you well, God bless, and have a great day.